our next panel, we're going to talk about food as medicine and its role in the public and communication. So I'd like to welcome our panelists, starting with Evan Sarris, the Deputy Director of Government Relations for Kroger Health. Bigger round of applause for Evan. We also have Erin Martin, the founder of FreshRx Oklahoma. Big round of applause for Erin. We have Crystal McGaffee, who is a Food is Medicine program participant and the Community Chief Nursing Officer at Appalachian Regional Healthcare. Round of applause. Just keep it going. I know you're all tired. And Laura Carroll is a Senior Advisor for Nutrition Outreach at the U.S. Food and Drug Administration's Human Foods Program. All right, so I'm excited to dig into this panel. Erin, I'm going to start with you. Something very exciting, as it was alluded to before, is happening in Oklahoma. Tell us all about it.
Yes, can you hear me?
A little closer, maybe.
Okay, no, I can speak really loud, but there it is. I think it's on. Okay, here we go. So yes, on May 1st, we passed the Food as Medicine Act of Oklahoma.
Woo!
It's super exciting. We had 5 unanimous votes on this bill, something that we can all unify around, which is what we desperately need. Yeah. And our final vote was 76-8. And we are just so excited. We definitely pointed to North Carolina, Massachusetts, and we had some critical things that happened that culminated. Stars really aligned for us. This senator actually introduced this bill 6 years ago, and people thought he was crazy. And he actually lived in a blue zone, so we had quite a champion. And we got the TA technical assistance from Erica with Chilpy at Harvard. We have a coalition of over 150 members across the state of Oklahoma. I co-lead that coalition, and we have a great program, a blueprint for the nation that people can really point to in Oklahoma, something that we can be proud of. So we're so excited. This requires the managed care organizations. We have 3 in Oklahoma. We actually just celebrated a year anniversary of those managed care organizations, managed care in Oklahoma. And so it requires those managed care organizations to pay for nutrition supports, grocery provisions, case management, and nutrition education and counseling.
What else, Erin, will help make it as effective as it needs to be? What do you need to make it really, game-changing?
Yes. We did not have funding attached to this bill because of not knowing what was going to happen with the 1115 waivers. There was a lot of people not feeling unsure about putting that on the 1115 waiver just because people were unsure. But that gives us a federal match and really would give us the ability to capacity build and keep those dollars in Oklahoma and community-based organizations. And we actually prioritize locally grown food in that bill. So we need to do thank you very much. Yeah, we source all regeneratively grown fruits and vegetables. If you don't know what that is, I'll tell you more later. But we really need support at the federal level. Like what's kind of been discussed now is that we are a USDA GusNIP grantee, and that has helped us scale, that's helped us test different innovations and practices, and that funding has been paused and delayed. Right. And that's something that's critical for this to continue, for these programs to keep innovating, and we need it in the 1115 waiver so we can really expand these programs and save the state hundreds of millions of dollars.
Yeah, and again, common sense stuff going
right
on here. Crystal, if I can turn to you, you have been sort of amazing at combining your professional life with your personal life, and like Herman, have a really sort of a wonderful experience to share. Can you talk about your journey?
Absolutely. So I'm Crystal McGaffee from Paintsville ARH. In 2021, our team was able to join the ARH team. And from that point, from day one, ARH and its leadership team have been forward moving with the health and wellness of its communities, its employees, and its patients. Through ARH, I've been able to join a CSW, which is Community Supported Agriculture, where ARH was able to subsidize 50% of the cost to employees to be able to receive fresh fruits and vegetables. We were able to prepare healthy meals and share those on a hub where everybody kind of takes part and takes pictures. We were able to participate with GSW and doing a video with Kitchen Shift, where we did a video to demonstrate healthy eating with Beth Cronenberg, which was produced. ARH has invested so much in its employees that we have free gym memberships for every single employee at our facilities. Employees are eligible to participate in grow gardens, where we grow locally at our facilities. There's either a garden or a raised garden that employees are able to grow fresh fruits and vegetables and take those home as needed. They provide a nutrition nook where people can go get health advice, gardening advice. One of my favorite things is every year we do with Holly is a hike with Holly, where all of our facilities come together and we do a hike that demonstrates healthy eating. We do a hike together, all of our hospitals together do that. This year we did some yoga in with that. There's always healthy eating demonstrations at those. And that might all sound like a lot of things that are just things, but together, through the last 2 years, with all of those benefits that ARH provides for me, I have had a successful 110-pound weight loss. So very instrumental. Herman and I both, I know that we're just one voice in a crowd, but we could be one voice of a million different people across the nation who have the same opportunities to do so. With that, when we talk about healthcare savings, at the beginning of my journey 2 years ago, I was on heart medication, I was on blood pressure medication, I was on GLP-1s and had been diagnosed as a diabetic. I'm no longer on any of those medications, thanks to being able to correct that with food.
Thank you so much for sharing your personal story. And as Dari alluded to earlier, it has to be a combination of like lifestyle changes. You mentioned gardening, you mentioned yoga. All of these things really contributed. Can you talk a little bit more about, what that meant to you to have those additional activities sort of as you're going on that food is medicine journey?
Absolutely. Herman talked about a lady that he was with that couldn't get up off her knees. I was a lady who was tired of being tired. I worked a lot with Beth Cronenberg, and we did a lot of nutritional education with her. Started going to the gym, started feeling better. The more that weight falls off, the easier it gets. And the more program availability that you have. ARH is so dedicated to offering those things, and their leadership team is really dedicated to making sure that we have the things that we need to be successful. So I truly appreciate that. But moving forward, I mean, it can be done by anybody. I was a 255-pound lady who thought that, next week wasn't going to be so easy. And now I wake up with a new dedication to life.
And I can attest to, she has a lot of energy. She's great. Laura, please give her another round of applause. Laura, my good friend, it's so nice to see you. I want to turn to you and get your perspective and ask you a little bit about how the private sector is working alongside government to support these programs. We heard a little bit about it earlier from Dana at Rockefeller.
Yeah, no, it's a great question, and I think FDA is very committed at this point in looking at public and private partnerships, right? There's a lot that we have influence on at federal government, but there's only so much that we can do, and so that is where the value comes with collaborating with those who are outside of FDA as well. One of the best examples that I can give right now is with some of our work with Instacart, which is actually part of HHS's larger Food is Medicine initiative. So some of you may remember back in December that we finalized an updated criteria for the healthy claim. So this is when a manufacturer of products can use the term healthier on their labels, they have to meet certain requirements. And it was 30 years old. It was very due for an update. So we're really happy to have that out and available now. It can be used. It is officially in effect as well. And back in December when we announced the updated healthy claim, we also announced our partnership with Instacart. So we are working with them to create a virtual storefront as well as a virtual tag so that it is easier for people to find those products that qualify for healthy. So that is hopefully just the beginning of ways that we will be collaborating with those beyond federal government. Healthy is obviously something that is primarily designed for product labeling, but there are lots of ways to use it beyond that, thinking about food as medicine initiatives and approved product lists, thinking about nutrition profiling systems, incentives for consumers when they're going grocery shopping. So lots that could be uncovered there that we would love to explore.
So much opportunity there.
Yeah.
And Evan, that leads me to you. There's so much opportunity with what retailers are doing to help people like Herman, to help people like Crystal, to help all of us to really get access to healthy foods. What's needed to scale that further for a company like Kroger?
Yeah, well, I think one of the great advantages for us is the access piece. So 2,700 locations across 35 states. We are in people's communities. And when our president of Kroger Health was looking at this situation, she said, we want to fill fewer prescriptions. And when you look at how prescriptions are filled, most of it is maintenance medications for chronic diseases. And all of those primarily start with good nutrition. So we're already in communities. And now we're looking at how we can provide the education and the tools for people to make the change that you have suggested you definitely wanted to do, and you did. And one of those is our Opt-Up Nutrition program. So we designed a system that's powered by something called the Food Health Score. And it is an in-your-pocket tool to give you a very clear, accurate description of everything that you're purchasing, and we will be able to tailor that to your nutrition goals. So whether you have a specific chronic disease, you want to lower your A1C, or you want to reduce the amount of sodium in your diet, you'll be able to do that. And ultimately, the goal is you can tie that score into an electronic health record, with your consent, of course. And then your pharmacist, who's in the community, and you see on average 1.6 times a week in the grocery store, you see them far more often than you traditionally see your physician. And they can help you mitigate through any issues you're having with your diet. So the tools are coming, and we're really excited to implement those with folks.
Absolutely, it's so important. I'll come back to you in a minute. But Erin, if I can come back to you, you recently told me that value-based care contracts are an important tool to value and incentivize the uptake of food as medicine. I don't get how that works, and I want to understand from you.
Food as medicine should be fully integrated as a healthcare intervention and not based in charitable outreach. This is treating chronic disease. It's not managing something that we can actually reverse. When we reverse diabetes in 8 months, people coming off of all their prescription drugs, and we're saving the managed care organizations, insurance, health systems, a lot of money. And the community should get that back. And so should the farmers who really worked so hard for this. And it's been really great to work with Ellen Brown, who's in the room, who really trained me in understanding my value and our value as a program and what we're producing and how we've scrounged together philanthropy dollars and produced all this healthcare cost savings. And so value-based contract, we have been moving away from fee-for-service. So why would we align food as medicine with that? We should be aligned and incentivized through outcomes, and that's paying for the full program, a price per month per patient, plus value-based care outcomes based on A1C reduction, blood pressure reduction, and we're really proud to say we have a contract, the first in Oklahoma, with that.
Right on. Thank you. Thank you. So great. And again, common sense. All of this makes perfect sense.
Yes. Yes, it's not a side, it's not just for you to keep members on your plan.
Right.
It's to really treat and reverse and prevent disease. And you're going to have so much more savings than you can even imagine with that, and community around that.
Absolutely. Crystal, you talked about the workforce wellness initiatives that have really helped you. I feel like those have, I know they've had impact for your family personally, but they're going to have intergenerational impacts because you're sort of building, your children will carry these on. Can you talk about, why that's important?
Absolutely. One thing that we're doing, or that I've set forth to do this year, is our community-based action plan, is to reach out to college students. We're going to do some videos for healthy eating on a budget. Another place that I always talk about and I'm very passionate about and see impact is our wound care centers. Our wound care centers are ridden with diabetics who are in wheelchairs, who can't walk, who have non-healing ulcers on their feet that just don't get better. A lot of that's understanding nutrition. And if you don't know what to eat, you're not going to get better. If we reach out to those people and we teach them what to do, we've watched it in our wound care center. We have a fantastic diabetic educator, Ashley Webb, who does a lot of outreach with those diabetic patients in teaching them how to eat, what their diagnosis means. ARH provides those patients with a food basket to go home with, to recreate the meals that they're eating, with food cards. These people can heal their problem if they are educated and they have the foundation to do so. So I feel like that makes a huge change if we work with our young people and we teach people about their diagnoses and that medication's not always what's going to correct their problems.
So exciting. And if you don't know what you eat, if you don't know what to eat, you won't get better. But if you do know what to eat, you will definitely get better.
Food is definitely medicine, and I'm definitely, Herman and I both, living proof of that. Like I said, we are a couple of voices that are millions of voices across the nation if the availability is there.
Round of applause for her, please. It's really inspiring. Laura, to help eaters, all of us, but not just Crystal and Herman, but so many of us, we need to ensure that physicians know what they're talking about, that they're well equipped with that information. And a lot of physicians just don't receive they receive about 1 hour of nutrition education. That's changing. But how can we, support healthcare providers and getting that education, even if they've been a doctor or for 20 years or so?
Yeah, the number one trusted source for nutrition is doctors, yet they have very little to no education in nutrition. So it's certainly an area of need of improvement. We at FDA have a couple of things going on. One is we have worked with, again, public-private partnerships, have worked with the American Medical Association as well as AAP to develop CME videos for physicians, pediatricians, other healthcare professionals on what the updated nutrition facts label is and how to talk to their patients about it so that they have a better understanding of how they can direct them towards how do you read the label, what is going to be the best picks for you. But we also know that there's these quick signals that are really influential to consumers, and we can be doing a better job of giving a snapshot of information in a few seconds. So that is where things like the healthy claim comes in, but our work on a front of package labeling. We did put out a proposed rule earlier this year, so it's open for comment if anybody wants to share their thoughts with us. But that could, again, also be another easy tool for physicians and healthcare professionals to point to their patients to on look for XYZ on the label when you are looking for certain foods for prevention or thinking about chronic diseases that they may have.
Front of label packaging, I feel like, is so exciting. It doesn't get enough attention. It doesn't sound sexy, but it's going to be really helpful for physicians, for all of us as eaters.
Yeah, I would say generally most people don't find labeling super sexy, but it is incredibly impactful. It actually has this really interesting dual impact, right? You're providing consumers with information, which can help inform their choices, but on the back end, it can also motivate industry to reformulate their products. And one of my favorite success stories is on trans fat, where we required trans fat to be labeled on the nutrition facts label back in 2006. We then saw a drop of consumption of trans fat by 80%. And that was due to consumers choosing different products, but then also industry reformulating.
Exciting. Thank you so much. Evan, I get to end with you. You and I had this great conversation earlier about how you're working with your competitors, and that's really important for scaling food as medicine. Can you describe what you're doing?
Yeah, so last week, Kroger hosted a first-of-its-kind Nourishing Change conference in Cincinnati. And we brought all of our competitors together to talk about what we could be doing as one to increase the access that we've been talking about all day today. It was a tremendous opportunity. We walked away with a lot of new ideas, not only how to operate in the private sector, but also how to engage with government to bring the change that we need to mostly get providers reimbursed for these services. Laura mentioned that we need to get more nutrition education in medical colleges. I would push back a little bit and just say, I agree with you, but we have hundreds of thousands of fully qualified registered dietitian nutritionists willing and able and ready to provide that service on a regular basis. They need the reimbursement. They need state scope of practice to catch up with where we are in our nutrition journey and allow them to practice up to their full potential. Get the pharmacists involved, allow them to be reimbursed for social determinants of health and providing access to that through a referral. Congresswoman Kelly was being humble in only mentioning one bill she's been working on. I have to also mention the Medical Nutrition Therapy Act, which should be introduced again in a month or so, increasing access to seniors with the most chronic diseases to dietitian services. It is a very limited benefit right now. And this very simple bill would expand that access, especially we mentioned all the increased access in GLP-1s and the importance of nutrition being coupled with those. The dietitian is perfectly positioned to do that.
Thank you so much, Evan. We are sadly out of time. Please give a round of applause to these panelists. We could have gone on for a long time. Thank you all so much.